In this video I would like to talk about the ethmoid bone. It has three main parts. We can say we have horizontal plate, we have perpendicular plate, and then we have lateral masses, which are also called labyrinth. So it has many surfaces like anterior, posterior, superior and inferior. First we try to check the superior surface, which is present in the anterior cranial fossa. So here we have anterior cranial fossa. So let's begin with here. So here, this anteriorly it's connected with the frontal crest. This portion is the frontal crest, and anteriorly it's connected with the frontal crest. Posteriorly we have the ethmoidal spine of the sphenoid bone. Here we have ethmoidal spine of the sphenoid bone. So posteriorly it's connected to ethmoidal spine of the ethmoid bone. And here, this portion I would like to mark it with other color. This portion is crista galli. This is crista galli, and lateral to this we have cribriform plate. Crista galli, it attaches to the false cerebelli, and this we can see there are this portion is cribriform plate, and as we can see there are many perforations on the cribriform plate. These perforations are for the passing of first cranial nerve, which is the olfactory nerve. Now we move ahead and let's see. So in this diagram we can see that we have this perpendicular plate of the ethmoid bone. This is the horizontal plate or cribriform plate. Also this is the crista galli. So perpendicular plate, inferiorly it is attached to the vomer, and it makes the vomer and perpendicular plate of the ethmoid bone. They collectively make the nasal septum. Anteriorly it is attached to the nasal bone, and in front of it, like here we have this frontal sinus. This portion is the frontal sinus. Posteriorly it attached to the sphenoidal crest. This is the sphenoidal crest, and posterior to which we have sphenoidal sinus, which we will study in the separate video. One more thing I would like to add here. In this diagram we don't have, but in the other diagram I will show it to you, that here we have at this portion we have the superior nasal concha, then we have the medial nasal concha. Here these both are the part of the lateral masses, which I show you in the next diagram. Now I would like to talk about the nasal conchas. We have three nasal conchas. This is superior, then we have this is middle nasal concha, and then we have the inferior nasal concha. But only superior and the middle nasal concha are the part of the ethmoid labyrinth or lateral masses. To see this clearly, we move to the interior portion of the skull. Here we can see this in the anterior portion of the skull. Just remember that we can't see the superior nasal concha, only we can see the middle nasal concha and the inferior nasal concha. But as you all know, here we have this is the middle nasal concha. On both sides we have, and this one in the middle, this is already marked. This is the perpendicular plate. So in the middle we have perpendicular plate, and lateral to which we have this middle nasal concha. But inferiorly we have the inferior nasal concha. Here we have inferior nasal concha, but these are not the part of the ethmoid. In between them, here we have the middle meatus. I would mark with other color. This portion, this is the middle meatus. Here we have the middle meatus, and here we have the inferior meatus. As you all can see, I talked earlier that perpendicular plate is attached to the vomer, and they both make the septum. So here we can see they make the nasal septum. And other function of the lateral masses, we have not the function, it's the extension. As you can see here in the orbital surface, the lateral mass make the medial surface of the orbit. Here you can see this is the ethmoid bone making the medial surface of the orbit of the eye. So this is the orbit, and here we have the medial surface, which is made by the, and you can see here we have this is we have lacrimal bone. So it is attached to the lacrimal bone. Here we have the lacrimal crest. I would like to, here we have lacrimal crest and then lacrimal sulcus, everything, but we are just talking about the ethmoid here. So in this position, as you will see, we have this is the perpendicular plate. Let me change the marker. So this is the perpendicular plate, this one. Then we have middle nasal concha, inferior nasal concha, but inferior nasal concha are not the part of ethmoid, and the superior nasal concha, they are not visible in the front surface So this is the median orbital surface which is formed by the lateral masses. Diagram from the posterior surface, we can clearly understand how the lateral surface are arranged. Here you can see this is crista galli, this is horizontal plate, and then we have the lateral masses. Okay, and you can see here this is the superior nasal concha, and then we have this lateral masses. This is how lateral masses form the medial. This is orbit, so this is the medial surface of the orbit, and this is the lateral mass. So this is how lateral masses make the orbit. And then we have this middle nasal concha, then we have the inferior nasal concha, but inferior nasal concha is attached to the, you can say, maxilla, and this is the maxillary sinus.